Hello, my name is Davion Cotton. I'm going to be covering the introductions of hypertension. This project is by myself, Barshayla Kitchen, and Desmond Prevost. So today we're going to be talking about hypertension and how it's formed, how you can prevent it, warning signs, and things of that nature. So you may ask, what is hypertension? Hypertension is another term for elevated blood pressure, which in terms is hypertension. Hypertension can lead to serious health issues if not contained early. Hypertension is also an added layer of risk when it pertains to developing symptoms of heart disease, stroke, and or death. More than half of underlying adults have this issue, which has yet to be discovered by them. Meaning, like I would say, people my age range from 20 to 30, they don't normally know when they have high blood pressure. High blood pressure tends to sneak up on you, and if not contained, it can create detrimental effects. How is it formed? How is hypertension formed? Hypertension forms within your arteries and your heart. The intensity and friction of high blood pressure compromises the vulnerable tissues inside the arteries over time. The narrower the insides of the arteries get, the greater the plague and injury. Family history also plays a factor on if you develop hypertension, meaning if your parents have had problems with hypertension, there's a chance that you could possibly experience the same symptoms. So like if your mom or dad or uncle, brother, sister, someone in your family has had problems with high blood pressure, then that can be passed down to you, or it may miss you altogether. But even if your family doesn't have experiences with high blood pressure, you can still develop those symptoms if you're not eating right, taking care of yourself, and things like that. You may ask, how is high blood pressure, aka hypertension, formed? There are certain underlying risk factors tied to hypertension: age and or race, family history, being overweight, not being physically active, using tobacco, smoking, too much salt and or too little potassium within your diet. Like if you're eating like 10 bananas a day per se, for instance, I would assume that would add a lot of potassium to your diet, and or using too much salt, seasoned salt and seasoning. I know within my community, the African American community, we tend to over season things sometimes and or add necessary spices which we feel make the food taste the way we want it to taste, but in terms that also hinders and hurts us as individuals, because over time, doing that over and over again, it can add on to hypertension and lead to certain things that develop over time, because normally times when you have high blood pressure, you never know it unless you go to the doctor regularly. And a lot of individuals, well, some individuals don't do regular checkups with their doctor, so they don't know that they have hypertension until it's kind of already on its path. Warning signs. I'm going to go over some of the warning signs of hypertension, which we tend to overlook sometimes. I know that some individuals, like I said, they don't know what hypertension is, or they do, they think that, hypertension develops, is hereditary. And it can be hereditary, but also it can develop, in other ways. So some of the warning signs are one of the most dangerous things that one of the most dangerous things is that hypertension sneaks up on most individuals, meaning that you may not know that you have developed it. Hypertension does not have any symptoms attached to it unless it becomes severe, and at that point it is almost too late. You can monitor your blood pressure by attending regular checkups with your doctor and or buying a blood pressure machine from your local pharmacy and or grocery store. I know if you go in places like Walmart, CVS, places like that, they normally have like machines already readily available for you to be able to test your blood pressure without seeing a doctor. I know that some individuals, like older individuals, would per se your grandparents, my grandparents, parents, if they're in older, like in the 50s range, they normally already have a uh, a high blood pressure machine readily available in the house to test their blood pressure. Um, very frequently. You can develop hypertension, high blood pressure also by, becoming angry. There's various ways that your blood pressure can raise. I know one time me and my grandmother went out to eat and we went to a restaurant called Gringo's and the meal rose her blood pressure exponentially, based off the salt and everything. She can't eat a lot of meals with a lot of salt in it. So that one meal, we tested her blood pressure on a machine that rose her blood pressure up tremendously. So, hypertension again can be passed down hereditary or it can be developed based on the individual's own doing. I'm going to be going over some more warning signs of the hypertension. So, warning signs continued. These are some of the symptoms that you can experience with hypertension. Before it leaves severe or at the severe state. Um, this is not a one size fits all symptoms. There's various symptoms and it'll vary from individual to individual. Meaning if Johnny has hypertension, he may have nosebleeds and Letha may not have nosebleeds, but she may have vision problems. So it all varies from person to person. Everyone's different. We are all made up of different DNA. So here are the warning signs. Nosebleeds, fatigue or confusion, vision problems, chest pain, difficulty breathing, irregular heartbeat, and blood in urine. So if you know and or are experiencing any of those symptoms, you may uh, need to consult your medical doctor and figure out, what's going on. And, if you get regular checkups automatically when you go to the doctor, I know when I go to the doctor, the first thing they do after they do the part of the routine checkup is, checking your eyes, mouth, nose, ears, etc. And then they automatically check your blood pressure. And then they even ask if you want a blood test, which is a thorough, I guess, investigation of the inside of your body and arteries to make sure everything is clicking on all cylinders per se. Last but not least, we come to the end of my section of the presentation. Thank you for listening, tuning in, all of you. Whoever's listening, watching. Here are the sources that I use. These are the sources from articles, basically, where I got a bulk of my information. And as you can see in the images that are coinciding with my slides at the bottom right-hand corner or the left-hand corner of the image, it has the author cited. If you click inside, you can see, where I necessarily got the image from, which is through PowerPoint images, and they automatically cite the image in the bottom corner of the image. Thank you for listening today. Thank you for tuning in. My counterparts, colleagues, they will go over their part of the presentation and what they found during their research. This is just my section, which was the introduction, how it's formed, how you can prevent it, some of the warning signs, and I thank you for tuning in today. Once again, my name is Davion Cotton, and this presentation is over hypertension by myself, Barshayla, and Desmond. Thank you.
Hello, this is Desmond Trivos, and I'm going to be covering the sections of children versus adults, epidemiology, as well as types and forms of hypertension. The symptoms of hypertension don't really occur until it's like an extreme state of hypertension, which then in most cases is pretty much late. But for cases of children, headaches, vision loss or double vision, chest pain, abdominal pain, breathing problems, or irregular vomiting occur in children, and for adults, severe headaches, nosebleeds, fatigue/confusion, loss in vision, chest pain, breathing difficulties, unnatural/normal heartbeat, or blood in the urine/stool are 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 the symptoms for adults. In statistics, around 1.3 million children around 12 to 19 had high blood pressure, which indicates around 1 in 25 children in the U.S. So if you want to put this in a standpoint of like a normal classroom of like around 30 kids, at least one of those kids is going to have high blood pressure. And for adults, nearly half of U.S. adults have hypertension, which is around 108 million adults. How it affects each: if high blood pressure is not treated or improved with life changes like exercise or weight loss or substantial treatments, for children, it can cause serious complications for them in early adult stages of life. In adulthood, high blood pressure can damage your body for years without you noticing from symptoms, because symptoms don't really occur, like I said earlier, but it can cause fatalities by heart attack or even stroke. It also damages most vital organs/body components like the heart, arteries, brain, kidneys, eyes, and can also affect sexual arousal in both men and women. This is the statistic standpoint on epidemiology. Heart diseases and strokes are some of the leading causes of death in America, and hypertension is the #1 cause of these conditions worldwide. Around 1.13 billion people worldwide have hypertension/high blood pressure. Low and medium income countries have the higher ratios, as 2/3 people with it live in these countries. Nearly 45% of U.S. adults had hypertension in a 2013 to 2016 study, which correlates to around 108 million adults. With that, less than 1 in 5 people have it under control. In 2018, almost 500,000 U.S. residents have died from hypertension or assisting factors of it, and 1 in 4 males and 1 in 5 females had hypertension in 2015. These are the classifications of hypertension. These are the classifications you want to look out for whenever you check your blood pressure at home or at the doctor's office. But the stages you really want to look out for are the stages of hypertension, like hypertension 1 or stage 2, or even hypertension crisis. You also want to look out for blood pressure, elevated blood pressures. You might want to consult your doctor for these things. But here are the numbers. For normal pressures, they will have systolic blood pressure of anything less than 120 and have a diastolic blood pressure of anything less than 80. Elevated blood pressures will have a systolic blood pressure of 120 through 129 and have a diastolic blood pressure less than 80. In the hypertension stages, stage 1 will have a systolic blood pressure between 130 and 139 and have a diastolic blood pressure between 80 and 89. Stage 2 will have a systolic blood pressure greater than 140 and have a diastolic blood pressure greater than 90. In a hypertension crisis, blood pressure will read greater than 180 for the systolic blood pressure and less than 120 for the diastolic blood pressure. You can also find these blood pressure charts on the internet, which shows these same exact classifications. Types and forms of hypertension. The two main forms of hypertension are primary, also known as essential, and secondary hypertension. Essential or primary hypertension. This form of hypertension occurs when your blood pressures are elevated for no reason or pre-existing conditions. In addition, it is the most common form of hypertension. Headaches, tiredness, dizziness, or nosebleeds are common symptoms for this kind of high blood pressure. There is no full cause, but smoking, drinking, obesity, or heredity all contribute to the cause. Secondary hypertension. This form of hypertension is formed from tissues in the body. The most common cause is abnormal supply of blood to the kidneys from the arteries. Some others could be restrictions in the airways, hormone abnormalities, or too much salt or alcohol in your diet. This is the types and forms of hypertension extended. These types of hypertension have specific classifications, such as the isolated systolic. This type is when the systolic pressure rises above 140 while the diastolic pressure stays below 90. It occurs in those aged 65 or older, and the cause is due to the loss of elasticity in the arteries. This can cause various cardiovascular diseases with age. Another type of hypertension is malignant hypertension, a rare form of hypertension that occurs in younger adults, African American men, and women with pregnancy toxemia. It occurs when the blood pressure rises quickly and reaches diastolic pressure over 130. Symptoms could be numbness in the limbs, headaches, vision problems, and chest pain. Resistant is another form of hypertension. This form may not allow antihypertensive medications to lower/regulate the blood pressure. It is more common in older age, African Americans, women, or in contribution with illnesses. Okay, these are my works cited. I just want to say thank you for taking your time out and listening to what I had to say. And I hope you grab some information from this project. Thank you.
There are 4 ways to determine hypertension. First is your medical history. Information will include both personal and family history. Many diseases are hereditary, so this will give the doctor clues about personal health. The next is a physical exam. The extent of the physical exam will be dependent on how elevated the blood pressure is and whether the person is at risk for heart disease. These tests will measure the pressure in your arteries as your heart pumps. For manual blood pressure measurements, a stethoscope will be placed over the major artery in your upper arm to listen to the blood flow. This technique will provide your systolic and diastolic numbers. The next one will be blood tests. This includes measurements of electrolytes, blood urine nitrogen, and creatinine levels to determine kidney involvement. Imaging tests. Electrocardiogram, also known as the ECG, to check your heart's electrical function. 1 in 3 U.S. adults have high blood pressure. In this next slide, I will show you various ways to take control and lower your high blood pressure for good. Medication. After the initial diagnosis of hypertension, medication is usually the next step. Doctors will take other medications individuals are currently taking into consideration to ensure what is prescribed will not counteract. Different drugs do different things in the body, so multiple medications may be required to properly manage your blood pressure. The doctor will adjust dosage as needed while monitoring progression, so regular checkups are important. Limit sodium. When sodium is in the bloodstream, it pulls water into the blood vessels, increasing the total amount of blood inside them. With more blood flowing through your vessels, blood pressure increases. The American Heart Association recommends an amount of 2,300 milligrams of sodium per day. One expert even suggests that if Americans move to an average intake of 1,500 milligrams per day, it could result in a 25.6% overall decrease in blood pressure. Reduce alcohol consumption. A single alcohol drink can lead to acute rise in blood pressure. Although this problem usually resolves itself within 2 hours, studies have shown that continued alcohol use across several days can create a more sustained rise in blood pressure. Consistent binge drinking can lead to chronic hypertension, which is a risk for coronary artery disease. Smoking. Smoking is detrimental for your blood vessels. Continuous smoking makes blood vessels harden and can cause blood flow difficulty, triggering hypertension. Smoking also contains carbon monoxide, which is an ingredient that affects the hemoglobin in blood, thus causing damage to the heart. As soon as you stop smoking within 12 hours, carbon monoxide levels fail in the body. Heart and lungs begin to function normally, which causes lowering blood pressure. Caffeine restriction. Caffeine is a stimulant. It makes the heart pump faster. A few hours after finishing a caffeinated drink, blood pressure will be a little higher than normal. So how much is too much? Less than 6 cups of caffeinated drink in the morning will not cause long-term problems or increase risk for developing hypertension. Any more than that, the possibility for heart disease increases. The biggest concern will be how the drink is prepared. Sugar and cream that is added to the drink present more health risks than the caffeine itself. Weight loss. Losing weight is one of the best ways to improve hypertension. For every 20 pounds lost, the systolic pressure can drop 5 to 20 points. Exercise. Regular physical activity makes the heart stronger. A stronger heart pumps more blood with less effort. When the heart can work less to pump, the force on the arteries decreases, lowering blood pressure. Any physical activity that increases the heart and breathing rates is considered aerobic activity, which includes walking, household chores, and dancing. De-stress. Sleep. Poor quality of sleep can affect your mood, mental alertness, energy level, and physical health. Relaxation techniques. Meditation, muscle relaxation, deep breathing exercises, and yoga are a few examples. Time management. Juggling work, family, and school can be tedious. Management of time is pivotal stress reliever. Last but not least, treat yourself. Have a massage, quiet time, or anything that you find enjoyable. That can eliminate all the stress. If you follow these 8 techniques, you should see major improvement in your blood pressure and could possibly cure the disease altogether. On behalf of Desmond, Davion, and myself, thank you for taking the time to listen to our presentation. We hope you have been informed on hypertension and have learned great techniques that could lead to awareness and underlying cause for this condition.